Welcome to our community broadcasting network featuring the Health and Wellness Best Practices podcast. Epidemiology is a scientific study of diseases and health-related issues to focus on finding ways to control or prevent them by identifying risk factors to inform public health policy. To discuss the practice of epidemiology is Dr. Katherine LeMasters, a social epidemiologist, researcher, and assistant professor at the University of Colorado Anschutz School of Medicine. Dr. LeMasters, thanks so much for being with us today.
Thanks for having me.
Now, you are a social epidemiologist, and there are a lot of branches to that type of practice. You want to explain a little bit of what that is?
Yeah, that's a great question. So epidemiology really, I think, was not a term a lot of people knew before the COVID-19 pandemic, right? And so there's this assumption that all of epidemiology is infectious disease focused. And really what epidemiology means is epi means outside. So it's outside of the body. It's anything non-clinical that we study that's in relation to health. So it's really public health, right, focused. And then social epidemiology really means that I'm studying social and structural systems that impact health and create health inequities. So that could be people who study the impact of education or income on health, the impact of racial segregation, of racism, of discrimination, of various neighborhood impacts on health based on the green spaces around you, etc. So really all these kind of social support, social stressors, social and structural things that impact health of individuals and of communities is what we study broadly.
So you want to talk a little bit about the different types of research and approach to epidemiology?
Yeah, I'd love to. So within epidemiology, there's lots of, I call them kind of branches, right? So a lot of epidemiology focuses on certain health outcomes. So you have cancer epidemiology, for example. So there you may have oncologists with some biostatisticians, with public health folks studying different new treatments for cancer, for example. And it's really that data analysis around that to try to improve outcomes for folks with cancer, to try to prevent cancer, etc. There's also cardiovascular epidemiology. So, right, folks studying heart disease and things like that. There's reproductive epidemiology, right? So reproductive health and different birth outcomes in that vein. There's lots of different pieces there. There's psychiatric epidemiology, really focused on mental health outcomes. My work intersects with that some because I look at kind of social and structural things that impact mental health. So I kind of marry the two. So it's not really hard lines that define it. They're often intersecting. And then there's other pieces similar to social epidemiology that really focus on these social and structural exposures, like environmental epidemiology. There's a lot of intersections there with the environmental justice movements, looking at, say, polluting factories and things, and how that not just impacts people's health, but disproportionately impacts, say, minoritized communities who might live close to that, impacts incarcerated communities, the focus of my work, we'll talk about later. And also things like occupational epidemiology. If you work in these factories, in these settings, how certain exposures, carcinogenic, exposures are you going to be exposed to and around. Probably the biggest piece, again, I said at the beginning, is infectious disease epidemiology. That's the one people think of most often. That's people, really at the Centers for Disease Control and Prevention, at state health departments that are investigating outbreaks, right? Currently, a lot of those measles outbreaks, that's a lot of infectious disease epidemiologists. And COVID-19, of course, that was infectious disease epidemiology. But again, I studied a lot of COVID-19, but it was how it's disproportionately impacting, say, incarcerated populations, racial minorities, people who are essential workers, people without citizenship, without certain access to services. But infectious disease epidemiology is certainly kind of the poster child of epidemiology. It's critically important. It's just not exactly what I do. But there you get a lot of, infectious disease physicians working in that space as well, getting kind of out of the clinic and focusing more broadly on how certain diseases are impacting populations rather than just how is that impacting an individual.
The ultimate result of work that you do is in public health policy. So it's really important for the right people that are policymakers to see the work and the research you do in order to appropriately address it for the community. Isn't that right?
Yes, yes, it is. So we work with policymakers, again, and practitioners at the state and local levels. I think one of the, accurate critiques of public health and of research is it stays in this kind of ivory tower. It doesn't We do studies and we publish papers and reports, and what does that do? So I really try for my work to be engaged with community members and with policymakers, which works a few different ways. That can be us kind of tracking bills that are going to be proposed and things coming up to try to with policymakers around the research that's informing that bill, etc. Or on the other side, trying to do work to evaluate certain bills. How are they being implemented? Are they having the intended outcomes in regards to people's health?
And why it is so important to look at root causes. In our case, we saw an awful lot of childhood trauma that indicated future substance abuse, PTSD, returning veterans from war. I mean, if you don't look at the origins, if you don't look at the root causes, I don't think you're ever going to solve the problem. So that's kind of what you do, isn't it?
Yes, exactly. Yes. I think a lot about root causes and root issues and how we often, again, in medicine and public health, it's hard to do that, right? It's easy to look at what's the mental health diagnosis this person has, what are their substance use needs, what medicine can we use to address this, which is, of course, critically important. You have someone in front of you who's suffering from schizophrenia, who's suffering from chaotic substance use. We, of course, need to treat that individual. But if we don't look at the trauma these people experienced as young children, at their mental health needs being dismissed as, say, quote, behavioral issues, if we don't look at the lack of access to care people have and all of the things they've been through early in life, especially all the medication, all the medicalization of it is only going to get us so far, and it's not going to address this at a population level or across generations. So one of the things I think is always really important to think of is these early life exposures are critically important. The socioeconomic environment people come from, their family life and background, the education they may or may not have access to, again, the discrimination and racism people face, all of these things they're murkier, they're harder to capture. It's hard to get funding and policy around it because it's a much longer time lag to seeing success or change, right? If we really invest in more, an example, education really early on in like free 2-year-old and 3-year-old preschool so we can get people up and in literacy, we know this impacts people's health if they have better access to education. We don't see that benefit in health for many, many years for those individuals. Versus if we have a policy where we're working on medications people receive, you see that pretty quickly, right? And you need both. And say if we don't address root causes, yeah, we're not going to really see large change. We're going to see this cycling kind of people within these systems, and that's what we see so much in my work is we see the same people cycling between substance use treatment, mental health treatment, jails, probation, etc., over and over again. And so many of them have unresolved childhood trauma, unmet mental health needs, etc.
And that leads us to a little discussion about your current research, which has to do with incarceration. You want to give us a little overview of what you're working on now?
Yeah, I'd love to. And I'll say overall, my work is really on mass incarceration as a public health crisis and as a public health need, right? Another one of those kind of huge systems that impacts people's health and well-being. 2 million people at a given time in our country, but is often not something we think about when we think about public health and medicine, again, because it's this kind of social and structural exposure. It's um, it's harder to study for a variety of reasons. It's outside of clinical work, right, and of medicine. And so within that, when I really look at incarceration and mass incarceration as an exposure, right, or as this whole population that's impacted, my work takes different approaches and different topics within that based on, again, policy priorities, based on community needs that have been risen. And so right now, a lot of my work and how I was introduced to you through Kate Rawlinson at Colorado Mad Mob has to do with competency and this kind of competency crisis our state is going through, where people whose, capacity to understand and assist in their case is questioned. And then ethically, of course, competency needs to be raised. But it's in the legal system, right? We have this legal solution that was made to create equity for people with disabilities, saying, well, we can't try this person or prosecute them if they don't really understand their charges. And so this really impacts people with severe mental illness, right? If you have kind of improperly treated or misdiagnosed mental illness, you're going to have a lot of people with schizophrenia, bipolar disorder in this situation. You also have people with autism and other intellectual and developmental disabilities and other neurocognitive conditions, like having a lot of traumatic brain injuries, for example. Then you also have the smaller proportion of folks, but that's present with dementia and neurodegenerative conditions who are stuck in the system. And so one of the things we're working on is really viewing this from this public health lens and this more holistic lens that says, well, we haven't addressed, again, these root causes. We haven't addressed all these needs in society. So people are ending up in the legal system. We have this legal solution. Of course, it needs to exist. But how do we be sure these people are properly treated and cared for and we can stop this cycling? Because right now, so many people cycle through competency over and over and over again who have, again, most often severe mental illness. So that's one of the main things we're working on that really came up through collaborations with um, advocacy groups, policymakers. Senator Amabile, for example, always works on competency issues, is really passionate about that space. And so trying to be sure we're doing something that has potential to really influence policy and help inform policy through bringing this broader public health lens, a social epidemiology lens to it. And some of the other work I do has to do with extreme kind of conditions of confinement in carceral spaces. So extreme temperatures, extreme heat and cold in prisons and jails and how that impacts health. And also this kind of more, again, this lack of root cause, addressing these root causes creates this really uh, tightly knit web of people cycling between um, sober living and different substance use treatment programs, mental health treatment programs in jail, this kind of local criminal legal involvement for these lower level charges that have to do with mental health and substance use. And they kind of stay in this local criminal legal system for many, many years and trying to understand that and work on ways to get people out of that system and into community care.
Now, you have quite a team that you have assembled in order to do this type of research, right?
Somewhat, yes. So there's three faculty, me and two addiction medicine physicians, one of whom is also a social epidemiologist as well. We funded the Addiction and Criminal Legal Health Collaboratory at CU Anschutz, and we have a couple of staff members and a handful of trainees, medical students, public health students that work with us, and many community partners as well, who are people with um, living and lived expertise in these systems of substance use treatment, of incarceration, and community partners like, nonprofits, reentry organizations we work with, to help kind of be sure our work is really relevant and serving a need that's in the community, to help give us ideas, to be sure we're answering questions of relevance, and then also to be sure our work is disseminated and well, in the community and serving the community.
Well, do you have any final thoughts for us today?
Yeah, thank you so much for having me. I think this work, right, especially social epidemiology, social and structural systems and things that impact health, it's not politically neutral. It's always changing with how policy, what policy is proposed, what's enacted. We're studying the effects of these policies because it affects people's lives above and beyond what medication has been approved, right, for a certain disease. And so I think there's really a push and a movement now within social epidemiology and I think in public health more broadly to be really engaged in advocacy around exploring these root causes and really fighting for the fact that these root causes impact people's health and they create health disparities and inequities, but also with that knowledge, then we can work to improve health equity, right, for the people who are the worst off. And so I think there is a need and a call for other people working in this space to be engaged in things like this and be engaged with policymakers to ensure that our work is really relevant to the people's health, who hopefully we're all working to serve.
I'm very interested in the type of work you're doing, so I hope you'll come back and share some of the specifics on your research and what's going on in social epidemiology in the future. Dr. LeMasters, thanks so much for being with us today. I really appreciate it.
Of course, thanks so much for having me.